So today we're going to be talking about diastasis recti abdominis, or DRA, most commonly seen during pregnancy and then postpartum. So diastasis recti is basically when your rectus abdominal muscles are separated beyond normal limits, and that connective tissue, that linea alba in between those muscles, is not providing sufficient stability and tension in that area. So this is a normal physiological process that is going to happen during pregnancy, right? By 35 weeks, almost every pregnant patient is going to have diastasis recti. It is a normal adaptation that needs to occur as the uterus and the baby expand and grow. So what you might notice during pregnancy is you might notice, your core getting weaker, or when you kind of bend backwards or use or engage your core, you're going to notice kind of a coning or a bulging in the middle of where those muscles would be connected. This is most commonly seen when you're getting in and out of bed or getting up from a seated position or laying down, as well as if you are active, if you're doing any core exercises. Of course, we want to avoid this during pregnancy. We want to avoid seeing the coning during any of our activities. Now, there's really no need to worry about it during pregnancy. It's not going to affect the pregnancy at all. And most of the time, like I said, we see it by 35 weeks. It's physiologically normal. Our belly, our muscles need to expand in order to make room for baby. When we really get concerned and look at it is typically postpartum. But some of the symptoms, so diastasis recti is a symptom, right? So diastasis recti will cause you to have a weaker core, but you might also, because of the diastasis recti and that weak core, you might experience more low back pain or more hip pain during pregnancy, just due to the fact that the core is not as strong. There are a few factors that contribute to diastasis recti. One of those being, if you're overweight when you get pregnant, if you're pregnant with multiples, if it's your subsequent pregnancy, and you never got the diastasis recti completely closed from the first pregnancy, you're more likely to have a greater gapping during each subsequent pregnancy. So typically, like I said, if we are currently pregnant, we'll just modify some things that we're already doing so that we do not continue to see coning or aggravate the diastasis recti during pregnancy. So we will change the way you get up out of a seated or a laying down position, and when you're getting out of bed, rolling to one side, using your upper body to get you up, and then altering some of the core exercises that we're going to be doing, avoiding crunches, sit-ups, those type of core exercises, and changing it to, more of like a side bridge or a dead bug, things of that nature, always modifying and checking for the coning throughout pregnancy. Postpartum, so typically the diastasis recti, if it's going to close on its own, it will be between that 6 to 12 week mark. So depending on if you're still breastfeeding, that can kind of prolong the closing just because we still have relaxin running through our body. So it might take a little bit longer if you are breastfeeding. However, again, like I said, if it's going to close on its own, typically by that 6 to 12 weeks postpartum is when it is going to do so. So one of the ways we go about treating postpartum is getting back to the basics, right? So diastasis recti is a symptom of core dysfunction, so we need to start rebuilding the core, okay? So one of the first things that we start with is intra-abdominal breathing, intra-abdominal stability during movement. So there are a slew of exercises that we slowly get into to kind of help get back to breathing, get back to basics, get back to engaging the core properly, and then adding in movements to really get that core nice and strong to kind of help close that diastasis recti. So like I said, if it's going to close on its own, it's going to close around that 6 to 12 week mark. So I don't even really check my postpartum patients until that 6-week mark. So typically what we'll assess for is we'll have them laying on their back with their knees bent, and then we'll have the patient engage in kind of like a sit-up or a crunch, and then I'm just palpating and feeling with my fingers, starting at the belly button all the way down to the pubic bone and up to kind of the rib cage, just feeling width and depth of that separation if there is any. Typically, the last place to close is that belly button region. And then, so after I have them assessed in that crunch position, I'll typically also put them in a side plank just to see functionally in a different position what that looks like. So the treatment is very individualized. Again, diastasis recti is a symptom of core dysfunction. So we really need to find out per patient where their dysfunction lies in the core system. So it'll be very individualized care, but basically getting back to the basics, right? So getting back to intra-abdominal breathing, activating the diaphragm, the pelvic floor, getting that core used to working again, and then getting into breathing in certain positions, so in movements, and then kind of working our way slowly into greater core activation exercises. Interestingly enough, babies are actually born with diastasis recti as well. However, theirs just inherently close as they start breathing and moving into different developmental milestones. So just like a baby goes through their milestones, some of the basic exercises and stretches that we will do is kind of putting you back into breathing into those kind of developmental patterns, which is so cool to see. And kind of that helps, again, engage the core, get the core activating again, so that we can close that diastasis recti. As I said, prevention is, there's not a whole lot that we can do to prevent diastasis recti from occurring. However, some things that we can do is if you know you are wanting to get pregnant or before conception, if we can really work on strengthening that core and already dialing into some of that dysfunction that you might have in the core and pelvic region prior to getting pregnancy, it kind of builds a stronger foundation so that after or postpartum, we can kind of get back to where we were. So prevention really starts prior to pregnancy. During pregnancy, again, there's not a whole lot of prevention that we can do because it's a physiologically normal process. However, we still go into breathing patterns and working on the core as best as we can, and altering kind of our core movements, in some of our daily activities to make sure that we're not getting that coning and stressing that diastasis recti even more during pregnancy. So that postpartum, we can have a little bit smoother recovery. So if you or anyone you know is currently pregnant or if you know postpartum, you can be years postpartum and you're still suffering from diastasis recti or separation of that abdomen, I would love to help figure out where that